I'm Garvin Lynch. Welcome to Lynch's Pharmacy video series. This video is on coughs. So coughs can broadly be described into two different categories, which are productive, where the patient is coughing up sputum, and non-productive, where there is no sputum. Patients generally describe them as being chesty or dry. To know how to treat it in the best way, you need to find out which one it is. So a non-productive cough would generally be described as tickly, irritating cough, and it's very unlikely to be due to a bacterial infection. It's usually due to some sort of damage of the respiratory tract, which may be because of a viral infection or often because of smoking. A patient might also say that they're not coughing up any phlegm, but they can feel it on their chest. So best to treat it as a productive chesty cough in this case. The cause of a chesty cough then can often be determined by the appearance or colour of the sputum that's actually coughed up. So if it's just clear white sputum, very little significance. It's very unlikely to be an infection. On the other hand, if it's thick green, yellow, brown coloured sputum, it's likely to be an infection and probably needs referral to a doctor for an antibiotic. Then clear straw coloured sputum often suggests some sort of allergic reaction, similar to the one we see in asthma. There might be blood in the sputum, there might be a lot of, or if there may be just some spots or streaks throughout the sputum, or it might discolour the sputum a brown sort of colour. In the same way, pneumonia patients often have a rusty sort of sputum, which often turns to clear visible blood at a later stage. In any case, any appearance of blood or any question about sputum always needs referral to a doctor, because it could be a sign that something far more serious, like TB or cancer. Most coughs are worse at night. But particular attention should be paid to a very dry night-time cough in a child. This could be an early sign of asthma. In the same way, special attention should be given to a nighttime cough in an adult with some sort of breathlessness, as this could be an early sign of heart failure. In any patient over the age of 40, serious lung disease should always be kept in mind when a presentation with a cough, especially if they have other risk factors, like they're a smoker or if there's a history in the family of lung disease. Then children between the ages of 4 and 8 can get a syndrome called catarrhal child syndrome, which is basically just a period of time when they get cold after cold after cold, often with an earache as well. It can be very frustrating and worrying for parents, but they can be assured that it's very normal. Antibiotics will do nothing for it because it's nearly always viral, and the child will just grow out of it by about 8 years of age anyway. A barking cough then in a child aged 6 months to 2 years could be croup. If there's any noise or wheezy breathing with it, they should also be referred to see a doctor. Finally, then a cough could also be drug-induced, particularly by a group of drugs called ACE inhibitors, which are taken for blood pressure. So ascertain if you are taking ACE inhibitors. If it comes up that a patient is on an ACE inhibitor, refer to a pharmacist, as he or she might refer the patient to a doctor who would need to have a look at their medication. If you have any questions, you can contact me through the live pharmacist on the website. You can email me or simply call into the pharmacy in Broaddale, up Maryborough Hill in Douglas. Thank you for watching.